Today we're going to talk about torticollis. Torticollis is most commonly seen in infants, and the most common being congenital, meaning that they are born with it. So typically this is due to either how they were in utero, if they were breech, just their positioning in utero before they were born, or they can get it through the birth process. So if forceps or vacuum extraction is needed, sometimes that can cause torticollis as well. So we typically see torticollis in the baby in the early on stages. So you will start to notice their head turning more one way and things like that, or preference feeding on one side. And typically it is caused by shortening of this muscle here. So it's called the SCM, the sternocleidomastoid muscle. So what you'll notice is their head tilt towards the affected side and rotate it away. So ear towards the affected shoulder, chin up and away from the affected side. So it's shortening of this muscle. So parents typically tend to notice this developing around that 6 to 8 week mark as baby's starting to move their head a little bit more. So what you'll notice is that they just won't turn to that other side. So it's really important that we catch this as quickly as we can, or as early as we can, so that we can start treatment, because obviously the longer that baby has a preference to turn to one side, it can cause kind of longer term problems. So like you'll get flattening of the head, so plagiocephaly. Towards the opposite side of the affected SCM, you'll get some weakness as well. So you might notice, lack of head control, problem sitting, janky crawling, janky sitting, not being able to reach with one arm. So those are things that can develop the longer we wait to treat this torticollis. So some things that we do in the office, obviously the evaluation to make sure we know which side's affected. The doctors, myself, will do stretching, some adjustments to those areas to make sure that, number one, baby has good range of motion in the joints so that they are able to turn side to side, and then stretches and muscle work on those muscles of the SCM to help decrease that tension and that shortening in that muscle. And then personally, I like to co-treat with an occupational therapist or a physical therapist that can do kind of the strength training to the opposite side. Like I said, as they get older, they're going to develop those compensations and that weakness on the unaffected side. So it's really important to kind of do both the stretching and the strengthening to really help resolve the torticollis. So a lot of the stretches and the exercises will definitely be dependent baby to baby. So I don't really like to go over a whole bunch of specific stretches to do at home. However, there are things that you can take into consideration for your day-to-day with your child that has torticollis. So some things we want to work on is changing the way that you hold the baby, or the side of the hip that you hold your baby on. If you tend to hold them on the left side and they have a preference to look towards you, they're going to want to keep looking towards mom and dad, right? So by changing to the opposite side, baby is going to want to look at mom and dad, so they'll be more prone to kind of turn their head the opposite side. So changing position in sides that you hold your baby on, changing their position in on their changing table or in their crib. So if you have something on the wall here and you're changing baby and baby wants to look that way, how you position them on the changing table is going to affect where they're going to want to turn. So changing positions, having a lot of tummy time. So we really want to focus on the tummy time to do a lot of strength and getting them to use to strengthen their head motor control. And then when they're in tummy time, it's important to kind of place toys or place yourself or get them to look the opposite direction that they prefer, so that we can again build that strength that way. And then there are other things that we can do, like choosing to feed on different sides. If they have a preference to feed on one side, obviously getting them to feed on the other side is important as well. And then having them take naps on you. So tummy time is really important, like I said. So having them belly to belly on you, and then kind of having their head turned to that opposite side during their nap on you will help kind of give them a gentle stretch throughout the day as well. And then there's a specific hold we typically try to encourage our parents to do with the baby. Usually it's affected side down and body kind of against back to mom and dad. Kind of in this position, if this was the affected side, have arm down, baby's back towards you, and just kind of stretching that head tilt side. And babies that are experiencing torticollis, it's also really important to limit the container usage, so the swings or anything that's going to restrict their mobility. So anytime we put the baby in a container, they are unable to move side to side because of that lack of mobility or the range of motion that they're in those containers. So if you are going to place baby in a container too, it's really important that we focus on the position. So either straightening their head, physically turning their head to the middle, or even to the opposite side as they're sitting in those containers, just to kind of help, again, improve that range of motion to that other side.
I'm looking down from up in the sky. I don't like it. How I've been without you for all this time. Good God, I'm bent out of shape now. You got a body like a model. You got a body that you always find. Open up a bottle, and baby you can have whatever you want. You taste so sweet, I can't help myself. You like candy, you like liquid honey. You taste so sweet, I can't help myself. You like candy, you like liquid honey. Oh. We're moving places I can't control. I don't know how to be without you. I don't feel whole. Look what you've done to me now. You got a body like a model. You got a body that you always find. Open up a bottle, and baby you can have whatever you want. You taste so sweet, I can't help myself. You like candy, you like liquid honey. You taste so sweet, I can't help myself. You like candy, you like liquid honey. You like liquid honey. You like liquid honey. No, you like liquid honey. You like liquid honey. You like liquid honey. No, I'm looking down from up in the sky. I don't like it. How I've been without you for all this time.
So if you have noticed when you're looking at your baby that it does have a preference to turn to one side, or you're noticing ear to shoulder tilt with the chin to the opposite direction, it's really important that we start care as soon as possible. So if you know anybody, I'd love to help. Give the office a call at 513-463-3011.